Hi everyone, welcome back to Think Like a Nurse 2. Today we're going to be talking about female reproductive disorders. In order to understand the disorders, we first have to take some time and recall the actual cycle, the menstrual cycle of the female. This will help us determine exactly what causes a disorder and how the client and or healthcare provider will need to respond whenever these circumstances or issues happen. First, we're going to talk about the menstrual cycle. Okay, that just means that a woman has a menstrual cycle, or actually shedding off of the uterine lining about once every 28 days. Characteristically, it happens around 28 days, and that's just kind of our target number. But for most females, they can go from anywhere from a 21-day cycle all the way up to around 35 days, and that can vary depending upon the actual female and her hormones, and or whether or not she's on any additional therapies. With the cycle, when we say the shedding of the uterine lining, that just means that the uterus, which normally would be the storehouse for a pregnancy, is actually shedding off in response to hormonal triggers. Around day 14 of a menstrual cycle, which day 1 being the first full flow red flow day of the cycle, counting ahead 14 days, usually around day 14 we call that kind of the hot zone area, and that's when a female actually ovulates, which means that her ovaries actually release or erupt with an egg that travels into the fallopian tube and waits there to be fertilized by a sperm. If conception, or if the sperm does not fertilize the egg, then the egg actually travels on down through the fallopian tube to the uterus and essentially is shed during the menstrual cycle. The lining of the uterus is called the endometrium. E-N-D-O-M-E-T-R-I-U-M, the endometrium. And this is actually what is shedding during the menstrual cycle. This, when a female has a menstrual cycle, it's actually just the tissues that are shedding along with some bleeding, so this would be expected. When the endometrial lining sheds off, this is a cleansing process of the uterus, meaning that the egg was not fertilized and that conception did not take place. Therefore, the egg does not or would not have any necessity to implant in the endometrium or the uterine lining. So the purpose of the uterine lining is to help sustain a pregnancy. There are some hormones that we deal with females, one of which is called estrogen, E-S-T-R-O-G-E-N. The next hormone that we deal with is called progesterone, P-R-O-G-E-S-T-E-R-O-N-E, progesterone. The progesterone or progesterone levels are what help to maintain a pregnancy or maintain the uterine lining. During a female's menstrual cycle, okay, and just menstrual does not necessarily mean directly bleeding, it just means that it is a hormonal cycle that happens about every 28 days, and we said around day 14 the female actually ovulates, which we talked about what is planning to happen at that particular time. The signal of the onset of the cycle is caused by changes in the female's hormonal circuit. Estrogen starts to drop or decrease, signaling that there's an egg that is there, it is ready, but at the time of a cycle, if it's not fertilized, then progesterone levels start to drop also and cause this uterine lining to start shedding off, which is essentially the menstrual cycle. If we have the egg here and fertilization or conception does take place, then we will notice that our progesterone levels have to remain steady and start to increase to prevent the uterine lining from diminishing or shedding off. So progesterone is very significant in helping a female to maintain a pregnancy. Okay? At this point in time, though, we're just really concerned about the cycle itself and what kind of client education that we need to provide to help our females either to know when to conceive or to know how to prevent a pregnancy. Okay? One of the first things we need to consider is how often or can we track the frequency and duration of menstrual cycles. One of the best things to do for a female is to encourage her to keep a menstrual calendar. This will give her an indication of when her menstrual cycle started, so that way she can have supplies readily accessible, such as sanitary napkins or pads and or tampons if she chooses to use either of those, so that way she'll be protected around the time she anticipates a cycle. It also helps her to determine around what time she would be ovulatory. As we are nurses, we encourage clients and we advocate for abstinence. If a client becomes sexually active or chooses to become sexually active, then we are wanting to promote their physical health. Therefore, we recommend using condoms for contraception and for protection against STIs, sexually transmitted infections or sexually transmitted diseases, and we advocate for use of an additional contraceptive method such as a foam or a gel spermicide. We also have to be very considerate of the client having a latex allergy and or allergy to different types of components such as the nonoxynol 9 that is contained in most spermicides. So that as a side note, those are just some client education pieces. We said around day 14 is kind of the hot zone area. We would tell a female to start actually protecting herself to prevent conception around day 10 to day 12 all the way up through day 20, because as we said, kind of the 14 is our magic number, but depending on the actual individual female, she may ovulate earlier or later than anticipated, so therefore that will help prevent an unintended pregnancy. If the client is trying to become pregnant, then she would focus on day 14 and start having intercourse every other day all the way up through day 20. But that does take some time and tracking of cycles and helping that female understand how her body works. Usually what we see happen whenever a female actually ovulates is an increase in basal body temperature. So this means her temperature, it's going to rise about, 2 or 3 degrees. No, it may only rise a fractional amount, but that's part of a tracking process to determine when the ovulatory cycle may occur. So we would notice an increase in basal body temperature, or BBT, and we would also notice an increase in the client's vaginal mucus production. And keeping the vagina moist in the environment that could potentially help to harbor a pregnancy or to help a sperm survive in the vaginal environment. Normally the vagina is very acidic, and that means it maintains a pH of at 7 or above. Okay, and remember that our basic like blood pH 7.35 to 7.45. Well, the vaginal environment also has to be maintained in that acidic environment to decrease bacterial production and also help to maintain a normal flora or balance. And during the actual time that the female is ovulating, she does have an increase in that vaginal mucus that helps to be more fluid and helps to transport sperm, because that is initially what the uterus and or sexual intercourse are designed for, is to reproduce. So what we're looking at in this particular chapter is determining about the cycle, how the female cycle actually works, helping the client to be able to track the cycle, and determining her time of ovulation, because that's going to provide us with some valuable clues to help us determine whether or not our client may present with a maternal problem and or inability to achieve a pregnancy, which leads us into our actual reproductive disorders. We'll talk more about that later, and I thank you so much for joining me here at Think Like a Nurse Too.